very interesting individuals here, and one was actually dancing to the beat of the morning rush, and you know how it is. Yeah, it works me up also, Mohammed.
I know, Chief.
Yeah, how are you?
Fine, thanks. How are you?
Very good, welcome.
Thank you so much for having us.
Yeah. Good. Please do tell us your name in full, Mohammed.
Mohammed Aburawi, originally from Libya.
Okay.
I'm coming here to Zimbabwe for the first time, coming from MIT, Massachusetts, in the US, and I have the privilege to being part of the upcoming symposium about leadership in health. I'm super excited. I think the team have put together incredible programming, and I'm really honored and humbled to be part of it.
Okay, so because you are here for the first time, what has been your impression of this beautiful city?
I don't want to leave.
You don't want to leave?
No, it's such a beautiful city. I think I haven't seen much of it yet, but I think definitely my first impression is the people, how welcoming, how generous, the hospitality has been incredible.
Do you know the funny thing?
What?
Our number one unique selling point in Zimbabwe is actually the people.
See? Yeah,
see?
It's coming across very nicely.
So we want to talk about some health matters here. Of course, Mohammed is visiting Zimbabwe from the United States of America. We're going to get a bit of a gist on what exactly they are doing. But he's not alone here. He's moving with a very beautiful doctor called Dr Mapfanyangira. How are you?
I'm fine, thank you. Thank you for having us.
Yeah, thank you so much for coming. She happens to sit on the board of the Zimbabwe Medical Association as the Secretary General.
Correct.
Please do give us a highlight of why we are here today and why we are talking to you.
Okay, thank you very much for having us. So tomorrow we have Leadership in Health Tech Symposium, and we organized it with Zimbabwe Medical Association and invited Dr. Mohammed here as one of our guest speakers. As you know, Zimbabwe Medical Association represents all doctors in the country, with also an interest in pushing the interests of the doctors, but as well as the public. So we are involved in, implementation, review of any policies that are made. We work with different stakeholders such as the government and other stakeholders. And as end users, it is important for us to be present in all the changes that are happening. And globally, there are changes in health, including digital health. So our presence in those changes will also help us put in our input in terms of those changes. So that's the main purpose of our symposium in terms of educating our population.
I'll come to you, Mohammed. Digital health is a big thing right now in the world, and we're living in the world of AI. If you could just shed a bit of light on what we can expect as far as that part is concerned.
Yeah, there's a lot of buzz around AI. It's just the term is being thrown around a lot. Interestingly, actually, the term AI was coined back in 1956, and that's like almost like 70 years ago. And I think what's interesting is it has been part of our lives. Every time you check Google Maps, every time you're on Spotify and you get that kind of automatic recommendation from your song. So it has been there, and I think just recently became more mainstream, and it captured the world's imagination because of generative AI and how we can talk to it and how can it understand and write and so on. In the digital health space, AI and digital technology has been there for a while, like when you think about telemedicine, when you think about electronic medical record systems. So it's a really integral part of healthcare. And I think it allows us really to do more with less resources. And I think this is the essence of where we really need to kind of adopt it and embrace it as an African continent, as countries that are really challenged with the resources. I come from Libya, so we have that stance, and it has been a challenge to kind of make the dollar stretch and make sure that we have optimum allocation of resources. So I think that is where AI really holds that promise for us, not just to kind of follow, but also kind of leapfrog and lead in that space.
Interesting. Obviously, coming to you, Doc, we have quite a serious deficiency, or we're lagging behind as far as where the global community is in the implementation of these digital strategies as far as healthcare delivery is concerned. What's your take perhaps on that matter?
But you are right. We are lagging behind in terms of, the global world. I think that's why, as a community, we are working on integration, cross-pollination. And Zima is mainly about continuous health education of our professionals. So this is just this is something that we do in every aspect of health. And this is just one aspect of health where we say we need to increase our knowledge base, open our eyes to say, what else can we do in terms of improving healthcare to our people. So I was having a discussion, and we're having a discussion over dinner about virtual reality, about how it may help a patient understand a procedure. I'm an anesthetist by profession, so explaining what the patient needs to expect, what they can expect in terms of the anesthetic process, the surgical process. Virtual reality can actually help, our patients to have a better understanding. We may not have access to teach in terms of human resources capital to teach people right in the, rural areas or, places that are far. But if you have access to some of these things, you can reach out to patients, you can educate them, you can remove some of the fears they have towards healthcare when you have this information. I know tomorrow we have a short clip on virtual reality on how we can teach kids on what to do when they're having an MRI scan, and that is quite helpful. So I think knowledge in this is very important to improve healthcare in our patients.
So just looking at that also in terms of the collaboration between doctors and tech innovators themselves. How is that space in Zimbabwe at the moment, and where would we like to be?
I think it's things that are really starting up. I think electronic medical health record system has been present in the country. I think the government is working on integrating it further. I think this is a space that they will be able to sort of like give information in that sense, but it's something that has already been there. But advancement obviously is still needed. We also have newer integrations in terms of even claim systems. When you're claiming for services given, we now have an integration for that to just help the process. But it's something that still needs advancement and needs working on.
Well, lots of work that needs to be done. In case you're joining me here, I'm joined by Dr. Mohammed and Dr. Muso, who are here in studio to come and discuss the issues to do with health tech. And of course, they've got a symposium that will be going on tomorrow here in Harare. So if you are in that particular field or interested in knowing what is happening, they are the guys to go to. And where are we going to be meeting?
So the symposium is at Crystal Lodge, Masasa, but registration is available online and at the Zima House for those who are interested. 172 pains.
Fantastic. That's interesting. We'll definitely be looking forward and giving you more details as far as that symposium is concerned. I'm coming to you, Mohammed. You are an African who's practicing in the United States, in the first world, of course, but there's a huge gap between Africa and the rest of the world. Your take as a doc in that space as well, and how can Africa, try to close that gap?
Yeah, definitely. I've seen that firsthand, just kind of seeing and interacting with patients and seeing all the toolkits that I have at my disposal, the specialists, the ecosystems, when practicing some of the top-ranked hospitals in the US, as opposed to when I was back home, but also working in other countries across the continent. There's actually a quote by Canadian writer William Gibson that I often reflect on, where he says the future is already here, it's just not evenly distributed. And I think AI and all of these digital tools really hold the promise to leveling the playing field, and then making sure that technologies that we are utilizing here on the continent are not lesser than what is being utilized in more kind of advanced and developed contexts. So it is an opportunity, I think, that the digital health presents. It is an opportunity to reverse the brain drain, to reconnect with physicians that left their countries and now just kind of bring them back virtually. With EMR systems, there is an opportunity to have that predictive analytics and, like, for example, know the complications of malaria before symptoms start to appear. There are so many things that I think that are hidden in the data, and data is kind of the new assets that we need to mine.
And to coming to you, Doc, also, talking about the training element, I know you touched on it a little bit, for your fellow colleagues. How is that going so far in terms of just trying to get guys at the front of this technology, guys to understand how the global community is operating. Like he's saying, that gap is very big, just to try and shorten it a little bit.
So, like we said, we're still static. We still have a long way to go in that sense. I think this is just the beginning of interactions, and to say how can we get more players, how can we get more people to, cross-pollinate in terms of information. So one of our speakers tomorrow is one of our, I think she's one of my juniors. She went ND training on health informatics, and I was working with her. I'm also an anesthetist, as I said, and I'm the past head of department at Parry, and we're working on an online booking system in terms of booking patients for surgery, and this will really help in terms of getting information together. If you want to do research, that will make it easier when you have all that information in one space. It will also help in reducing conflict in the OR in terms of bookings, because sometimes you have those issues between anesthetists and surgeons, but we want to come together. I think we worked on it with the past HOD in surgery as well. We said, okay, we're having these problems in our system. What can we do to make it better? Can we not have an online booking system where we actually can track the patients that are done, the type of patients that are done? Is it a major procedure? Is it a minor procedure in that sense? So we've got one of our speakers on Saturday who's going to educate us on health informatics, and hopefully it will encourage the younger doctors to move into that space, move away from just, I want to do straight on clinical medicine, I see a patient, and then I go home, and to just diversify in terms of that.
As we wrap up, Doc,
Yes.
what would be perhaps the vision in the short term and perhaps in the long term as far as health tech is concerned, in your view, from the perspective of the Zimbabwe Medical Association?
So our theme, actually, we have a congress in August. We have an annual congress for doctors, the Zimbabwe Medical Association. This year's theme is transforming healthcare in Zimbabwe through innovation, digital integration, and sustainable care. And we're looking towards, having different partners to come in and, enhance this discussion in terms of how we can improve healthcare, including in education. Yeah.
Very, very interesting, and we
Yeah.
definitely wish you all the best in attaining that. And Doc Mohammed, time is always an enemy in a program like this. I would have loved to talk about Libya a little bit. Just when was the last time you were there?
A couple of months ago, actually.
At least he goes on.
No, definitely.
We have a very illustrious figure that we know here. So anytime you talk about Libya,
let me guess.
yeah.
It has been, I think the country is going through a rough patch.
Yeah.
But definitely, I think with the efforts that are happening on the ground, but also through the community in the diaspora, things are changing, and I think healthcare is definitely a big component of it. I think even here in Zimbabwe, the symposium, efforts from local professionals, the community, is really what gives hopes of the future, and it provides kind of that foundation for a better tomorrow.
Fantastic. We're talking there to Dr. Mohammed Aburawi. He's from Libya, but he's practicing and working in the United States of America, and he's here in Zimbabwe to join Dr. Mapfanyangira and her colleagues at the Zimbabwe Medical Association on a symposium where they're discussing health tech as one of the major subjects. So we'll be keeping you updated right here on ZTN Prime. This is the Morning Rush, and thank you so much, doctors.
Konapo, ipapo.